So good morning or good afternoon, everyone. This is teaching video number 1. This is my husband Ashley, and he has decided to volunteer for us today. So I'm going to show you what I use as a full body treatment in my treatment space and why it's effective. So anyways, I'm going to turn the camera and we'll be on Ashley now. Perfect. Okay. This is a massage teaching video. We're going to do, there's some basic massage techniques, and then we're going to add to it. Just, just your basics. We say hello to the body, or warm up the body. Important when you're doing technique to pay attention to what you're doing and be active in what you're doing, not thinking about something else. Your eyes and your ears and your mouth, everything is inside your hand, and you're sensing dysfunction or anything that feels out of place. When I went to massage school, it was my understanding that striation of muscle was very straight, perfect, and uniform, were the words that were given to me. So again, I look for anything, and I mean anything that's out of place. If it doesn't feel like it's uniform, straight, and parallel to itself, then it's probably not supposed to be there. Here I'm using breath and I'm using some rocking, right? I can use vibration, I can use whatever I want, right? It's just a matter of creating that connection with the body. So for the shoulder, specifically, when we look at the shoulder, we want to make sure we're covering this border, and this border, because what happens is this GH joint here moves in what's called the force couple. And if you don't remember what that is, or you don't know, you should probably look it up because it's really important. Anyways, in kinesiology, this force couple works as such, and your inferior border, which is right here, your scapula, moves 2 to 1 to this GH joint. So when this inferior border isn't doing what it's supposed to do, and it has quite the range of motion, it should be able to move all the way around. Okay, it should have quite the range if you're able to move your arm properly. Okay, and in his case, his is stuck. So you would take the arm as such. Okay, and I'm pushing right on the inferior border, and I'm bringing the arm through every bit of range of motion it currently has. Okay? So you're going to move up from that point and move, about halfway through the infraspinatus muscle. You're going to push a little bit and you're going to breathe. And bring the arm into range of motion and breathe out. And bring it through the other side. Okay? You always want to bring it out to the other side because you want to extend the range of motion and you want it to give it that allowance. It creates space in the joint, okay? So anyways, we do 3. 1, 2, 3. I'm right at the top of the shoulder here. Okay, and I'm coming back. So I'm going to hit number 2 again. Okay? And I'm going to hit number 1 again, okay? You see how the shoulder is completely coming back here, okay? And we're 5 minutes into treatment, and I've barely done anything for him, and I just did a couple of points, and his shoulder's already back into proper alignment, okay? I'm just going to check the camera and make sure everything is still working good. Perfect. Last time I did one of these videos, it stopped taping on me, so I'm just going to periodically check. Okay. So anyways, I just do a couple of these all over the shoulder now, right? Because the idea is you really want to get that shoulder moving in that range of motion now, right? Because it's got all that extra range, so you really want to just poke around and play with it a bit, right? So he's got lots of adhesion through the lateral border of his scapula. So there's a couple of techniques you could use here. You could use, a subscap release. I used to use a lot of myofascial release, but since I learned acupressure, in my opinion, acupressure is way more effective. But myofascial release works just as good, okay? So I'll use either or. I have favorites of certain techniques. So if I'm going to use an acupressure point, okay, I'm going to look at this border and I'm going to split it into 3 again. Okay, we're going to use 3s. Right, so I'm going to lift at the elbow and I'm going to start at the lower border. So I'm right at the inferior border again, and I'm going to lift up as far as it'll go and then bring it back down. Okay, so breathe in and bring it up. And breathe out and bring it down. Okay, and we're going to go up again. See, each time it's getting a little bit further. Breathe out. I'm going to go back to the original point. We always hit 5 points. Bring it down. Okay, and we come again up. Okay, see, we're back at point 1, and we can barely move his arm up to start with. Okay, barely. Now he's got a shoulder that's just almost brand new. Okay, and that took 10 minutes. It's not even, I don't think. So, as you can see, you could use acupressure. I'll do a subscap on the other side, but I much prefer doing it this way to start with, just because subscap for most people can be a very difficult area to get into, and this is less aggressive. And some people, you know, for myofascial release can have like a rippy, teary, burning effect. It can also be very, very mild, but at the same time, if you're releasing the area that's causing the problem, it's still going to have that rippy, teary, burning effect, right? So this kind of eases off the pressure in the back, allowing you have more room in the subscap, okay? And if you have more room in the subscap, it doesn't hurt the client as much. So that's always the goal of treatment, is to make it effective as possible, as well as no pain. So here I'm just going to take my arm, and this is the fascial stuff. You know, I'm going to use some fascial work on his rib cage. I'm just going to hold one side and kind of pull away, right? Just pull away, right? And I do some of this pretty quickly because, you know, I mean, it doesn't really take a lot. You know, I do a lot of fascia work on him, so his fascia is in pretty good shape. I mean, it takes minutes to release him, whereas, you know, if you got somebody that's been suffering for quite a long time, they are going to encounter issues. Okay? So, just depends on how good the fascial tissue is and how much blood flow has been going to the area, whether of how long the recovery will take, right? So we're gonna leave this shoulder like this now, and we're gonna move on. And do the exact same thing on the other side, right? Massage principles, right? Basic principles. Always treat the unaffected area. Now, if you can keep your concentration long enough to do the exact same thing on the other side, that's always best. Okay. But if you're just learning, you know what I mean, that's going to be hard for you. So, you know what I mean, take your time and don't be hard on yourself. This is a learning thing. And palpation really takes a long time to understand, right? I really found that palpation was really important in this job. So when I started, you know what I mean, that was one of the first things I worked on, was how to palpate every single thing and understand why it was out of place and why it was not the way it should be, right? I guess I'm slightly OCD, but that's what happened. Some people just say it's, you know, part of an engineer's brain. Maybe I was supposed to be an engineer. It's a good thing I went to massage, though. So this for Ashley specifically here, okay, he has about a year ago he was hit with a skid steer, and his shoulder now chronically moves forward on him on a regular basis. So this shoulder is the one that happened to, and yeah, it constantly feels like it's subluxing, okay, which is a partial dislocation. And so it's really important for this shoulder to either gain some strength, or otherwise, you know what I mean, over time, you know what I mean, as a practitioner, we know that his arm is not going to get any better. It's just going to keep causing the problem. Here I'm taking the trap, or the edge of the trap rather, and I'm just kind of doing a very general, right, because I know his shoulder's completely out of joint. I can feel it as I move his arm around. I can feel it is completely forward. So when you have a joint that's completely out of joint and you're working on it, it's very important to understand the end feel of the joint. Not the degrees, but the end feel, right? So the end feel is where the tissue stops moving, or the joint stops moving, okay? And so that's your end feel, right? So you need to understand that, because when you understand the end feel of a joint, you understand that it'll move more, okay? So with this joint in particular, this joint has 180 degrees of rotation. And it does a lot of different movements. It has six actions, not 3. So when looking at it, okay, we want to make sure we take it through at least 4 of those to create that momentum and that energetic flow again, right? So I'm taking it through the top because I don't want the joint to go any further out of joint as I move it in the back here, okay? So you're gonna do the top first, okay? If you have somebody that has a very forward roll in their shoulder, okay? That's the only time I would hit the top first, okay? Then, in his case specifically, we have this border, so the spine of scap, okay? We're gonna do a various amount of pressure points here, okay? So I want everybody to pay attention closely. So you're gonna piece off the scapula, okay? We talked about the GH joints here and the forced couple. Really, really important. So this shoulder, we're going to cover points that are really, really important, okay? So from the top of the spine of scap, okay, so towards the neck here, we have levator scap, the muscle that attaches here. And then we want to landmark again and find the inferior border of the scapula, okay? So basically I have 2 fingers like this, okay? I'm actually going to move that camera so we're closer and we can see what the heck we're doing here, okay? And we are taping, so I'm going to put you here. Can you see what I'm doing? Yes, you can. Okay, so we have this point and this point, okay? The superior part of the scap and the inferior part of the scap, okay? And then we have the mid, okay? So basically you're going to take 1, 2, 3 points, okay? Off the medial border. You're going to take 3 points off of here, so you find the edge of the border again. You come off the acromion, so the acromian's right here. Okay, so I'm one finger off of there. And I'm going to go in the middle for 2. Okay? Then I'm going to find the spine of scapula. Okay, and I'm going to find the acromion again. Okay, here we are. And I'm going to go in the middle of that. Okay? So we just made a complete triangle. Okay? With the scapula, we have 3 points along the medial border, we have 3 points along the lateral border, and we have 3 points along the superior border. Okay? And all you have to do is move it through a proper range of motion in order to get those points to work for you, mostly, okay? The medial border a little bit trickier, okay? So, first ones we're gonna release is the lateral border. because the lateral border of the subscap, or sorry, the scapula is always the most, it has the most problems. It doesn't matter what client comes in my office, every single person is stuck through here. Everyone. And then it causes rib cage problems. It causes shoulder dysfunction because we start walking like this. And most of us sit and look at our phones all day, so we're like this anyways, right? So we don't even notice our posture. And particularly with the subscap and this area here, this is a highly effective technique. So we're going to take this arm, and again, on the other side, we started at the inferior border. So again, we're going to start at the inferior border. 1. Move up to 2. Move up to 3. Move up to 2. Okay. Shoulders already moving better. And again, the 3. Okay. Right. So it's already nice and floppy on this side. Okay. Easy peasy. Easy peasy. We did the top 3 like I showed you before, because as I said, your shoulder was out of joint. So the most important thing about having somebody, if they have a shoulder out of joint, you don't want to make it worse. Okay? So you ease off the areas that would be causing the problem, and then you do the work. Okay? So now we're going to do the 3 pressure points on each side, because I've left that till now specifically. All right, so take this elbow. Okay, we're going to take left scap, and of course, you know what I mean, when you're lifting, people use regular lifting protocol. Okay, brace yourself and take care of your body first, right? So you're going to push into the left scap here, right at the top of the medial, like the medial border, the superior border of the scap, and we're going to lift. Okay. And we're going to come off the medial border here again, and we're going to go and there you go. His shoulder now moves totally normal. Okay. He has all the range of motion there, so he's still stuck. We can see that it pulls up right away. We can see how stuck he is still through there. Okay. We come through here. He has full range of motion now. But you can see now as I bring him through here, it's stuck again to the lat and teres and major minor. Okay, so just some things to keep in mind when you're massaging, but that's a pretty good shoulder right here. Okay, for most clients that's enough work. You don't need any more than that. Okay, that's already pushing most boundaries there, you know, and it'll get them feeling better, it'll get the blood flow in there and get them healing. Okay, that's the goal of treatment always, is to heal. Okay. So oxygen and blood flow to everywhere means heal. That's what that means. Doesn't mean you're in charge of healing anybody. It just means that you create healing through oxygen and blood supply, right? Because the blood is the nutrient, it flows everywhere. This chart that we have on the wall here, this shiatsu meridian chart, okay? Most textbooks aren't going to say this, but that chart right there is the blood flow of fascia. It's the system to fascia. Okay, it's your energy system, as the Chinese believe, or as you know, this one's Japanese. You can look at Thai medicine one, particularly. I'm qualified in a lot of Thai. So you know what I mean. When I look at this meridian system, it's pretty identical. It's pretty close to Thai medicine as well. The Ayurvedic, the Indian systems and the Chinese are much more advanced. But I have studied Chinese medicine myself, and I mean, so this is a nice happy medium chart. Okay, so if you want to get one of those, I highly suggest it. It'll help you understand things on a very deep level. Okay, So here we're going to do pressure points again because you can see that he's very fascially restricted through here. Okay, so normally we would take the spine and try and, you know, create some movement there, right? There's a big energy line through here. It's a huge, massive, it's the dominating energy line of the body, okay? And it comes all the way, right? So it's right here. And it's the governing, it's called the governing meridian, okay? Go figure. Anyway, so if you tackle this one, the other ones will be much happier. So you always stimulate the spine, okay? Until we've got it moving in a nice, you see how it flows? It's just, I can push here and it just does what it wants. It gets tighter down here, we can tell. And then over here, it's, you know what I mean? The body just does whatever it wants now because it's happy, okay? So, we're gonna take a look at Ashley's feet here. It's blue. Okay, his legs are very red. You can see that he hasn't been stretching a hell of a lot lately. Okay, so just, you know what I mean, when you're assessing your clients, pay attention. Like, this is stuff that we learned in school, right? What is the texture of their skin? What is the tone of their skin? Okay, what does it feel like? Is it warm? Is it cold? You know, like palpation. Really, really important. Palpation, right? You feel. Okay? You feel. Right? So we're going to do some fascial techniques for the foot here. Okay? Now this is not in any fascial technique book. This is my own variation of what I learned from two very smart men. Okay? And then also what I learned in Thai massage. So I'm an advanced practitioner in Thai massage, or so that's what my teacher would call me, I think. I also do reflexology, because like I said, I work with meridian lines. I don't, I mean, my understanding today of the body is that tackling muscles one at a time doesn't do anything. It only helps the one area, right? You have to treat the body as a whole. The whole thing operates as, like as Bruce Lipton calls it, a community of organisms. Okay, so your body is a community, as he would say. You're a living community of organisms, right? So really, really important. You can't treat the body as a section. It doesn't work. You take medications and, you know what I mean, 90% of the time it's going to mask the problem. You know, unless it's dealing with the problem specifically. But even then, some cases, it doesn't work that well, you know. We have to learn how to take care of ourselves and our body will not break down. It's that simple. So you can see that his leg is really restricted. It has no range of motion. So I'm just doing some pressure points here. You're watching me manipulate the ankle joints here. So I'm using, you know, around the ankle. So 1, 2, 3. Again, it's always 3 points I'm using, always. Okay, and I always just come back on those. So I start with 1. With the shoulders, very specific. With this, it's not really. You just need to be around the joint. Okay, and I would make 3 points around the joint. You've also got what's called in Chinese medicine ST41, stomach 41. Okay, this is a very, very important line for your digestive system, and it impacts the whole leg as a whole. Okay, so just keep that in mind. So I push. So in Thai medicine, we would push on this, and we would do a breathing. So we use our yogic breath and. And as you breathe out, you're focusing your energy into your thumb. Okay, and you're opening that energy line. And then we just kind of because we want to wake up the energy line, right? So this is a way to wake it up. This is called cupping, right? And because it's over the bone, we can't massage there, can't really do pressure points, right? So we wake it up like this. Okay? Because his foot's not doing much right now. It's not happy. So now you can see, I mean, I've got some range of motion in his ankle. I'm not gonna stay there because, you know, I mean, a lot of his problems coming from the leg, right? But unless the foot opens up, you can see it's already less blue. Okay, like I didn't realize it was gonna happen that quickly, but yes, so there you go, it's less blue. It was totally blue when we started. I pointed that out to you, it is now not blue. Okay, so that's how effective my techniques can be, right? So what we're going to do here is we're going to open up the quad. Okay, we're going to open up the quad and we're going to do what's called stretch the knee. Okay, and stretching the knee, it's complicated because most people believe that you should not hurt or stretch joints or whatever, okay? So it's not actually stretching the knee, it's just allowing that synovial fluid to get back in there, and if it hasn't had a lot of range of motion for a long time, this really opens it up really nicely, okay? It solves 90% of knee joint problems. Again, you know what I mean? And I can say that because I've seen it happen, okay? So basically on the way up, we're coming up this lateral border, okay? For 3 points. Sorry, 3 points again. So I'm gonna cup the knee like this, okay? Because there's very important structures in here we don't want to touch. So I'm gonna cup it, but I'm gonna put all my pressure into this side of my hand. So basically I'm pushing down like this and I'm holding, okay? So I'm not really putting a lot of pressure down. It's about 30%, okay? So I'm just going 30%, I'm pushing down 30%, and I'm moving this foot. And you can hear it crack already, the knee, okay? Because it needs this stretch. Okay, we're just taking it to the tissue. End feel again, right? Feel for that end feel. There it is. It doesn't go any further. Okay, come back down along those same points. Okay? See? Look at how nicely his leg already moves. Okay, so now we're going to do this again, but we're going to do the exact opposite. Okay, we're going to come up this inside of the leg. Okay? So now we're starting here and we're coming down, okay? And we're gonna bring the leg off to the side because we want to create length on that inside hamstring, okay? People's adductors can be really, really tight and pull the inline of the leg and the body, right? So once you've got it to loosen up a bit, you just kind of rotate and move up as you need to, right? So like I've got the leg moving very nicely at this point. So this is also a really important technique to use. So here we are, okay, we're just gonna go 1, 2, 3, 2, 1, okay? So I grab the foot and I'm going 1, 2, 3, 2, 1. Okay. Now 1, 2, 3, 2, and 1. Okay. So now we know. Look at this. No no cracking. His knee is coming all the way up when before we couldn't even get past here. Okay, so like I said, this is a really effective technique. It works right now, not later. Okay? So we're gonna come on this side of the table, and again, you're gonna brace yourself, right? Because you wanna use proper body mechanics. We're gonna go 1, 2, 3. Okay? 2, 1. Same idea, same thing. Okay? Same but different, as my teacher always says. So 1, and notice I'm bringing the foot inside this time. So I'm bringing it in towards the joint. Okay? The other side was out. I went like this. So you always want to create pressure to the joint. Okay? So down and up. Down and up. Down and up. Down and up. Okay? Down and up. So this side you want to be careful with, obviously, because you can hurt the knee. Okay, so it's very gentle. This is very gentle. There's no pain. There's no, reefing on the joint. There's no hurting it. Okay, it's just simply nice, gentle, but firm pressure. Okay, very gentle and firm pressure. Okay. So, anyways, is your leg itchy?
Okay.
So his leg is itchy. That means he's got blood flow. That's what's happening there. He had blood flow in his leg, and he didn't have very much, and that's why it's acting that way. Okay? So now that we got the legs open, we can do the glutes. Okay? And again, the glutes are very, very specific, and it doesn't take a lot. Okay? So 1, 2, 3, 2, 1. Okay? 1, 2, 3, 2, 1. Okay? Now we're going to come off. I'm just going to move you back over here so you can see me. Here, let's go this way. Let's see if that's good enough. There we go. Okay. All right, so here we are. We're gonna go 1, 2, 3, 2, 1. Okay? So 1, you bring the leg out. Remember, on the lateral side, you bring the leg out. 2, 3, 2, 1. Okay? Now we're gonna do some pressure points here, okay? For the QL muscle. Okay, so we're gonna do the points for the QL and the hip area, okay? So these are 1, 2, 3, 2, 1. Okay, so remember how tight that was before and we couldn't get this to move? Look at this now. See, it's moving very nicely, okay? So now we're just gonna go back and we're gonna finish some work in the glute and, just complete this side. So this, I'm just taking piriformis. And I've got about, 50, 60% pressure here. And I'm just gradually bringing the leg out, okay? And I'm gonna bring it back in because I don't want it to get comfortable with my pressure. And then we're gonna bring it out again. And usually when you bring it out like that for the second time, it totally releases, okay? So now we've got a really loose hip, okay? See? We did not have that before. Okay. So now I'm just going to give this a couple more because I want to make sure that the work is good and I want it to stay, right? So the idea would be then to just do whatever it is you do to make, your clients comfortable and create that length for them and allow it to change and stay, right? So I just really try and get the body moving to its natural rhythm, right? I really like to do this movement because what it does is it allows the hip to really expand through here. Okay, so you'll see me do this a lot where I come in and I'll unwind the leg like this, you know? So, and the purpose for that specifically is because you got to think. We walk all day, right? Or, well, some of us walk all day, some of us stand, some of us sit, whatever it is. But we're constantly in this motion, right? Constantly. So, you know what I mean? It seems only natural that you want to go backwards, you know, to try and counteract some of that effect. Right? It's like reverse engineering. You get a problem, you reverse engineer it. Same idea. So again, here we are with this leg, okay? It goes a little bit further. I'll bring the camera on this side. Okay. Perfect. Okay, so again, we're gonna do the same thing we did on the other side. Okay, so the other thing I'll notice here is that his foot, I mean, it's not blue on this side, but it's definitely not getting a lot of blood flow. We can see this through here. So we're just going to do some foot treatment stuff. And yes, it's my husband, and I probably shouldn't need to wear a mask, but I'm doing it because I'm in my office, and I think it's probably appropriate. So, and so is he. Was tight. That toe. some foot problems going on there. Okay. Despite people may think your feet are actually really important. I'm not saying that that's what you guys think, but you know, I mean, some people don't really credit their feet to be that important, and I mean, we stand on them all day, so it's pretty important to make sure that they're in good alignment, because if they're not in good alignment, you're not going to stand properly. Right? You also don't balance properly, because 90% of your balance happens on your big toe. Okay, so now we got the foot. I'm gonna come back for these hamstrings and the quad. Okay. And his inner hamstring here is very tight, which is a very big indicator of his adductors as well. Another place to check when you're dealing with chronic hip pain is obturator externus. Right? So and I like to just keep momentum with my body. Like, I do a lot of rocking. It's good for his system. It's good for your system. It creates momentum, and this is the way Thai massage is done. You know what I mean? You always put that rock into what you do. You move into your work, right? Huh?
That's better.
Yeah. So as we looked at his foot before, it was really dark with spider banding. Now it's less. Okay. Immediately. That's how fast this stuff works. Immediately. Okay. So the system is immediately getting blood flow and oxygen. So it's going to heal right now. Okay. So that's what we go for. We don't worry about nothing else. Everything else is way too complicated, okay? You just need to worry about providing oxygen and blood. That's all you need, okay? You know, if you want to go into more complicated things and understand on a very deep level, you know what I mean, you can, obviously, because that's the way I went. And that's why, you know what I mean, I have the techniques I have, but a lot of what I figured out, honestly, is because I had so much pain in my own body and nobody could help me. So I had to figure it out. I didn't have any choice, right? I'm 38 years old, and I mean, I had had so many injuries over my life that I just wasn't able to, you know, function very well physically anymore. And then on top of it, I went to the gym and I tried to, you know, get in shape, and I tried to do all that stuff. But the gym made me worse because it then brought out other problems that were in my body that I didn't know about. And so I ended up hurting myself pretty severely in many ways because of trying to fix things and not knowing how. So by all means, by trial and error and a ton of experience, I've been able to figure out what works in a non-invasive way that's not more painful or traumatic to the system. Okay? Because like some people think that no pain, no gain. And I mean, yes, okay, in some cases, you know, in some areas like subscapularis or psoas, there's going to be a little bit of discomfort. But it should never be hurtful. And the person that's applying the pressure should never be applying any more than that's necessary. Like I'm barely touching Ashley. I'm using 30% pressure, okay? And all I'm doing is I'm focusing my attention in my thumb. Okay, my head, my eyes, my ears, my mouth, everything I said before, it's in my thumb. I'm sensing. This is what palpation is, okay? I mean, you could sit there and you could try to palpate muscles all you want, but that's not how you palpate. Palpating is understanding what makes the muscle a muscle and the dysfunction in it. Okay? Palpation isn't understanding where the hell muscles are. And that was, you know what I mean, the misconception I had in school. So I don't know. I don't know. Palpation, in my opinion, is all feeling, and it has everything to do with the muscle striation, how taut it is, your 4 T's, so tone, temperature, texture, right? So, you know what I mean? You just make sure goal is not to hurt, it's always to, so we can see that he's very impaired here because his other side lifts up immediately. So I'm going to go for piriformis again, because it's always the problem. When you have that problem, that tilt in the hip, it's always coming from the sacrum or a tight piriformis, one or the other. Obviously hip flexor dysfunction on the other side, but we're not going to talk about that on this side. We're just going to talk about what's going on this side. We'll figure out the rest on the other side when I get there. So, you know what I mean? It's important to understand that when that hip lifts up like this, you got a tight piriformis. And I can feel it because it kicks in immediately underneath my finger. Okay, so I know it's piriformis. I'm not... So now Ashley's leg is moving just like the other side. Okay, and if we pulled Ashley's leg up like this, it's still gonna, he's still got tightness all the way through, but you know what I mean, this is gonna ease off the pressure immensely. Okay, so now we're just gonna take the leg again like this, off the sacrum. Okay, 3 points. You get your 3 points. So I just felt it move there. So now I'm going to come back to this one. 1, 2, 3, 2, and 1. Okay, so now his body's just swaying. You know what I mean? It's not doing it, but you can feel how loose he is now, right? Okay, so Ashley has very tight piriformises. It doesn't matter how much work we do there. Okay, when you only have an hour to work on someone, you're not obviously going to work it so many times. I go for 2 releases in the glutes. If I get 2 releases on the piriformis, we're good to go. Okay, I'll move on. Right? So that's the idea, is you want to get 2 releases there and then move on. So before we switch sides, okay, we're going to again, take, you know, our fingers and do these nice round circles, okay? Right? So the other thing I like to do sometimes is when it's too tight on this side, I'll take the other side and I'll do the same thing. We were here and it was lifting. Now we're all the way over here before it starts to lift. Okay, so it's much better. He has lots of range of motion through here now. Okay. So again, just like the other side, we're going to do pressure points for the QL. Just gonna rock them. I feel that this shoulder needs a bit more work, so I'm just gonna do that now. This is floppy now. Floppy, floppy. Okay, sometimes you just gotta work out the rest of it to figure out what else needs to be done too, okay? So that is the posterior side of the body. Thanks everyone.